Jamie. I'm going to be your nurse today. Can I have your name?
Shipasha.
Her name is Gigi Alva.
And when's her birthday?
October 5th, 1940.
And what's bringing you in today?
So I had found my sister this morning. Her left side of her face was drooping. She did not seem herself at all. And when I tried to help her walk, she couldn't.
Okay, and when did you notice that starting?
Sometime this morning after breakfast.
Do you know around what time?
It had to have been around 10 a.m.
What kind of medical history does your sister have?
She has a history of high blood pressure only.
Does she take any medications?
Yes, she's very good about taking her metoprolol at home.
And has she ever had a stroke before?
Oh God, no, she's never had a stroke.
Okay. Gigi, so what I'm going to do is do a quick assessment on you, okay? I'm going to have you pull down your mask.
Asha.
Can I have you smile for me? Let me see your teeth. Okay, we could put your mask back on. Alright, now what I'm going to have you do is squeeze my hands. Okay, now close your eyes for me. Close your eyes. Alright, perfect. So, Dr. Neely will be in just a second to check you out, okay?
Shapa.
Hi Gigi, my name's Dr. Neely.
Dr. Neely, we have a 57, this is Gigi. She's a 57-year-old female with a new onset of left-sided weakness and left-sided facial droop. Her sister stated the symptoms started around 10 a.m. It is now 11. Patient only has a medical history of high blood pressure, but does take her medications regularly. Patient has been hypertensive at 200 over 120, heart rate of 102, respirations of 20, SpO2 of 95% on room air, and a blood glucose of 102. She has normal sinus on our monitor.
Okay Gigi, so I'm going to do another assessment on you, okay? I know that you're having some trouble speaking, so I just want you to nod your head if you can understand me and to answer, okay? Alright, can you pull down your mask for me? Can you smile? Alright, thank you. Alright. So you can just look straight ahead and I'm going to look at your eyes. Alright. And can you follow my finger with your eyes? Okay. And then I want you to look straight ahead, way over there. And then when I tell you, I'm going to bring my finger closer to your face, and then I want you to look at my finger, okay? But look far, and now look at my fingers. Thank you. All right. Can you squeeze my hands? Okay. Can you close your eyes? Okay. I want you to tell me if you can feel this, okay? I'm going to brush this over your skin and just nod for me, okay? Nothing over here? Do you know where you are today? Okay. Gateway Hospital? And are you Gigi? Alright, and are we in the year 2021? Okay. Can you press up against my hands with this leg? Thank you. And what about with this leg? Alright. Can you press against my hands with your feet? And up towards you. Alright, so the CT scan did show that there's no signs of active bleeding, but we did see that you are having an ischemic stroke, so you do have a blood clot that's in your brain, okay? And it's cutting off oxygen to other parts. So we're gonna start you on a medication called TPA, okay?
What is going on with my sister? Is she going to die?
So she is having an ischemic stroke, and this medication is gonna break up that blood clot, because right now there's no blood or oxygen getting to those parts of the brain. So if we can break that blood clot up, we can get some blood flow back through there and also oxygen, okay? We're going to continue to monitor her over the next few days and see how she progresses, and you are welcome to stay with her, okay?
So that medication, the TPA, that's going to help, that's going to take care of it?
We're hoping that it will help. We won't know until we can continue to monitor her, okay? All right, Jamie, so I'm gonna order 50 milligrams of TPA to be infused over an hour. The first 10% will be given as a bolus over the first minute.
50 milligrams of TPA to be infused over an hour and first 10% over 1 minute. Got it.
Okay, so Jamie, while you're setting that up, I'm just gonna enter these orders into the computer and I'll just say them out to you right now as well. So we're gonna monitor BP and neural checks every 15 minutes for the first 2 hours of administration, then every 30 minutes for 6 hours, and then every hour for the remaining 16 hours. We're also gonna monitor and assess for complications such as allergic reaction, angioedema, neurological decline, bleeding gums, GI bleed, and any brain bleeding. So that can manifest as headache or confusion.
Okay, thank you, doctor. Alright, it's nice to see you guys again. So how's everything been going?
We've just been taking things day by day. It's good to see you too, Jamie.
And Gigi, how are you doing?
It's been good. It's hard to do some activities.
And how has physical therapy been going for you?
It's been going good. I'm able to slowly use my left arm again, and my sister pushes me to get better.
That's awesome and really nice that you have a sister here that supports you. Dr. Neely will be in here shortly to see you guys, okay?
Okay, thanks, Jamie.
Thank you.
You're welcome.
Hi, Gigi.
Hello, Dr. Neely.
How are you doing?
I'm doing good.
Good. And what about you, Ava? How are you doing?
I've been doing all right. I'm just trying to help my sister get back to normal as best I can.
Okay, good. So I know that you're doing physical therapy at another facility, but here we're gonna try something different, okay? It's called Care Partners and Constraint-Induced Movement Therapy. So you'll wear this mitt, this special mitt. It will go on your unaffected arm, and it will help you to use your affected arm more so that we can build up the strength on that side, okay? So you'll wear this mitt for 90% of your waking time, and you'll perform daily activities like putting the groceries away, brushing your teeth, eating, because we want you to really be using that arm that's a little weaker, okay? So you'll use this at home, and when you come in, we'll do things with you here with that mitt as well. So you'll come for 10 sessions. They'll be 3 hours long, okay? And then Ava, your job is to help Gigi at home with activities, encourage her to use the mitten, and then also come with her for the 10 sessions. So does that sound like something you guys are both interested in?
Sounds good.
Okay.
Yeah, it sounds very good. I think I'll be able to help my sister a lot with this therapy.
Good. Yeah, I think you guys are both great candidates for this type of therapy because you guys are really close and you do live together. So then Jamie will come in and talk to you guys about having a diary to record activities and progression, any personal goals you have, Gigi, or that both of you guys have as a family, secondary stroke prevention, and then self-care as well, okay? So I may stop back in later to see how you guys are doing while you're talking to Jamie, but if not, I'll see you guys next week, and you guys have a great day, okay?
Thanks,
Thank
Alicia.
you, Dr. Neely.
You're very welcome, Gigi. It was good to see you again.
Alright. Now that you had your visit with Dr. Neely, let's talk a little more, okay? So what kind of improvements have you guys noticed since this happened?
I've noticed my speech is getting better, and slowly left hand again.
You are sounding a lot better than when I first met you. How about, what are you finding more difficult to do?
I find it difficult to eat without spilling, and it's difficult in the morning to brush my teeth.
Okay, and we'll definitely work on those with you. But today, I would just like to work on setting some goals. What do you guys want to see being accomplished in these sessions?
I want to be able to feed myself without spilling and take care of myself without my sister's help.
And we want to see that too. So let's first start. What are you eating?
So I've been buying and preparing finger foods for her. I have them ready for her in the fridge and in the cupboard so that way when I'm not around, she's able to get to them and eat them herself.
Okay, that's good. In the next week, I'd like you to progress in using a fork. In your next appointment, I'd like you to demonstrate how you've been using that fork for me, okay? I would also like you to incorporate a diary for you guys to start recording the activities and what you eat throughout the day.
Okay, so I just wanted to show you I brought these with. I ordered these special utensils for some people who suffered from strokes. Would these be a good option for her?
Yes, those actually look perfect, and I recommend using them at home as whenever possible. Getting back to normal daily activities can be hard. It is also essential to Gigi's therapy that is an autonomy supportive environment when she is performing these tasks. So when you guys do things, and so offer her choices and be supportive and encouraging. For example, instead of saying, you need to do this exercise, say, how can I help you do this exercise? Just make sure she's making the choices for herself.
My sister doesn't understand how difficult this is for me.
Okay, for both of you, this time is very hard to both of you for different reasons. The role of being a caregiver can be very challenging. So Ava, to help you better understand what your sister's feeling, I would like you to try to wear this mitt on your dominant hand and try to attempt the activities that we are teaching her.
Okay. Sure, why don't I use one of these utensils I brought? Oh gosh. Can't even get a hang of this thing. Oh goodness. I definitely could see how frustrating this would be.
Okay, good. Both of you will have to work and try to understand how each other are feeling. It's okay and healthy for you guys to express concerns to one another respectfully. Before we end this session, I would like to make sure you both know how important it is to both you recognize the signs and symptoms of stroke. So I'm going to ask you now, can you both name some signs and symptoms of a stroke that you need to be looking out for?
I had actually found a very helpful poster online. I can't really remember what it was called. It had the signs to look for of someone who could be having a stroke. Do you remember what it was called, Gigi?
Be fast.
Yeah, that's right.
The B was for balance, so you'll have loss of balance. I was for eyes, so blurry vision. F was for face, so face drooping.
And the A was for arms or leg weakness. The S is for speech difficulty, and T is for it's time to call 911. I've also been making sure that she takes her medications at home, so she's taking her metoprolol. She's also taking that blood thinner that you guys had given her. So we're trying to make sure to prevent having another stroke.
And a baby aspirin.
That's awesome, Nick. Sounds like you guys are doing a great job of that. We covered a lot in this appointment. Do you guys have any questions or concerns I could help you with?
No, I don't think so. I think we're okay. Do you have anything, Gigi?
None at the moment. Thank
Alright.
you.
Sounds Sounds good. Then I'll see you guys at your next appointment.
Thank you so much,
Thank
Nurse Jamie.
you.